Good morning. I'd love to introduce who recognized Joe Gruder, Senator from District 23. We also have Chuck Henry, Health Officer, Florida Department of Health in Sarasota, and Nick Pachota, IMT Lead, City Council Member, City of Venice. Thank you all for being here. What a beautiful day to be in Venice, Florida. You understand why people want to come here. And it's an even better day because we're able to announce that, as you can see, we're hosting a vaccination site here at the Venice Community Center to vaccinate 3,000 seniors over a 3-day period. These seniors were pre-registered through the Sarasota County Health Department. The seniors will receive the Pfizer vaccine. We'll be able to come back to this same spot for the booster shot in 21 days. I've also increased Sarasota's county's allocation of vaccine at the state-supported vaccine site at Sarasota Square Mall at 8201 South Tamiami Trail by 3,700 additional vaccines, which will bring that site from 3,300 a week to 7,000 a week. So we're And then yesterday, we announced the expansion of retail pharmacy locations in conjunction with HHS's federal pharmacy program. So we have 119 Walmart and Sam's Club stores across 34 counties that will begin giving shots for seniors on Friday. This is almost a third of all Walmart and Sam's Club throughout the state of Florida. And the initial announcement, they actually did not have any Sarasota County Walmarts, but we're actually working to be able to make it available at Walmart in Sarasota as well. If you want to schedule for Walmart, walmart.com/COVID vaccine. Probably a lot of them have been taken already. For Sam's Club, go to samsclub.com/COVID vaccine. Additionally, Publix, which we had 325 Publix across the state of Florida, 23 counties, that is now able to be expanded to almost 600 Publix locations across 41 different counties. And here in Sarasota County, that includes 22 public pharmacies in Sarasota County, including 5 Publix right here in Venice, Florida. So this morning, they opened the site up for vaccines for Friday, Saturday, and Sunday for Sarasota County. You can go to publix.com/COVID vaccine. Now, what I think Publix has done, which is great, is they open up this window, and everyone rushes to get on, and then like an hour later, they have tens of thousands of slots that are just taken. And it's like if you miss that window, then what, you got to wait for the next week. And so we want to make it so that folks have the ability to do this. So what they're now doing are different appointment windows. So they did this morning at 7 a.m. for Friday, Saturday, Sunday. Then they're also going to open up an appointment window Friday morning at 7 a.m. And they will accept appointments for Monday and Tuesday. And then they're going to open it up Monday morning, and that'll be for next Wednesday and Thursday. And so I think that is good because there's a crush of folks that want to get on it. And when you do it all for the week, it's out in an hour, hour and a half, and then people got to wait the whole next week. So this way you have an opportunity to be able to do it. Now, what we monitor with Seniors First, which is we're doing Seniors First. I know some other states are doing it differently, focusing on younger, healthier people. We're putting our parents and grandparents first on this, and our goal is to give every senior a shot that wants a shot, and we're going to keep doing that. And we're not going to change until the seniors are taken care of. But what we look at is, okay, how many seniors are getting shots in each county? What percentages of seniors are getting shots in each county? I mean, there's some counties that have a lot of seniors have gotten the shot, but they have a lot of seniors, so their percentage is a little lower. There's others that, in raw numbers, there isn't as many seniors as like Sarasota, but they have a high percentage, and so that's good. So it's surprising when you look at it. The number one county so far in Florida for seniors, the percentages of seniors that have gotten a shot is Leon County, which is 61% of seniors in Leon have already gotten a shot. That is way, way higher than the national average. You also have massive counties like Palm Beach, which is nearing 50% of all seniors, one of the largest counties in Florida with 25% age 65 and up. But what we've been identifying last week were Manatee, Charlotte, and Sarasota, they were between 20 and 25%. So we wanted to make sure that we're increasing availability in those counties to be able to get that percentage up. And so because of that, we are doing this site today. Obviously, we're happy to have the Publix expansion in Manatee and Sarasota. Charlotte has already had the Publix, and we appreciate that. So between this vaccination event and the increase in the state allocation to the existing sites in Sarasota, the vaccine doses dedicated to Sarasota County have increased by 85% in just 1 week. And that is by looking at data. That is by figuring out where the need is. And so some of the counties that are doing well, they didn't get 85% increase because, you know what, they're doing good under the existing regimen. So we think that that's the way to do it. When there's a need, we fill it. I spoke with Senator Gruters just yesterday. I said, trust me, we're on it. And here we are this morning to be able to do it for everyone. So to date, we have vaccinated more seniors, over 1.5 million reported, and probably closer to 1.7 actual because these reports take 4 or 5 days to really be current. That is way, way more than any other state by hundreds and hundreds of thousands. Of all the people that have been vaccinated in Florida, close to 75% of all shots have gone to senior citizens. And we are now about 35% of all of our 4.4 million seniors have received at least one shot. Obviously, doing things like that is going to help us increase it even more. And so we believe that the seniors first is the right approach. We believe it's reflected in the numbers in terms of the vaccines. And we also think as we go forward in a few weeks, you're going to start to see it reflected in the COVID numbers. Now, we're going down. Everyone's going down in this across the country. Hospital admissions, hospital census, emergency room visits. Maybe that's just a natural cycle, but I do think you're going to start seeing this vaccine effects kick in, and you will see fewer seniors as a percentage, hopefully going to the emergency department and going to hospitals. And that's what it's all about. Keep people healthy, make sure that they can live their lives in a very full and dynamic fashion. We don't want people to have to be isolated in their homes, being scared. We want you to be able to have confidence to go out, see your friends and family, and obviously when you have a 95% vaccine, that's a great way to be able to do it. We're also continuing to do other ways to get vaccines out to members of the communities. We have a great homebound seniors program that we've done. We started doing Holocaust survivors in South Florida. I was in Miami. We did Bay of Pigs veterans. And then we're also going to be doing more announcements along those lines later this week, which is really, really good. We're also working with a lot of churches and houses of worship to be able to do events at church property or in the community in conjunction with churches. So we've done 45 different church-related events, and that's more than 33,000 vaccinations just with our houses of worship. It's actually not limited to churches. I mean, we've done a lot with African-American churches, but I was at a synagogue in Aventura the other day, and we had Jewish, Christian, and Muslim, 3 different houses of worship coming together at the synagogue to vaccinate elderly people. So we're going to continue to do that. With county health departments, some of them are doing a really good job. We have 105 community vaccination sites across the state of Florida. Every single county in Florida has at least one site to be able to get vaccinated, and some counties have huge numbers when you count the retail sites. And we've also held vaccine events at 15 senior communities across the state. So we've been at Sun City Center, for example, right up the road outside of Tampa. We're going to be doing another community pod announcement tomorrow. When you have communities that are senior heavy, you can kind of set this up, get in there, and then you have thousands of people that can go through over the course of a couple days. It's a way to get a lot of shots in arms in a way that's very efficient and effective. So the supply of the vaccine, we are getting more on a weekly basis than we had been. We had been getting about 250 to 266,000 initial doses a week. Last week, we were able, so basically the week that's just now finished probably on Monday and Tuesday, we got 307,000. And then this week, where you're going to start Wednesday, Thursday, Friday through the weekend, it's 325,000. So because we got an increased dosage, that's part of the reason we were able to up Sarasota and the surrounding counties there. The pharmacy program that we outlined yesterday, the great thing about that is those are doses in addition to the doses we're already getting. So yes, some of the state's allocation has gone to Publix, but all the new Publix locations and all the Walmart locations, those are doses, tens of thousands of doses direct from HHS that are not a part of the 325,000. So it's 325,000 plus the new pharmacy locations, which is tens of thousands of doses, which we think is really, really good. We do think the Pfizer is going to start increasing. I can't tell you if it's going to be next week or 3 weeks from now, but with their schedule, we're going to be able to get more and more Pfizer. So if we're able to get 50,000 more doses of Pfizer a week, combined with the federal pharmacy increase, that puts us in a much, much better spot in terms of vaccine supply than we have been. And then we're looking at the approval for the Johnson & Johnson vaccine at the end of the month. I don't know why they set the date for the end of the month. I would think you'd want to burn the midnight oil and do 24/7 and get this thing approved as quickly as possible. I believe we show a sense of urgency in Florida about this. It was a little perplexing. I think it could be approved earlier. Bottom line is it's going to be approved at some point, most likely at the very end of this month. And there is vaccine available that J&J has produced that will then go out to the states the next day. I don't know how much that is. I mean, obviously, if it's like 1 million for the whole country, that's going to be a drop in the bucket. If it's 10 million for the whole country, well, that would be hundreds of thousands, maybe 500,000-600,000 for the state of Florida. So the Johnson & Johnson vaccine, the data was very, very good. It was not portrayed as positive because they say 67% efficacy at preventing infection, but after 28 days, it was 100% effective at preventing death and serious hospitalization, which is really the most important thing. I mean, if you take J&J vaccine and you end up with cold-like symptoms for 2 days, that's not the end of the world. What we're trying to do is keep people out of the hospital and save lives, and I think the J&J vaccine so far, from what we know, does that. So we'll put that to use as well, and that will, again, hopefully be a significant increase in dosages going forward. But rest assured, as more doses come in, we're getting it to the places that need it and that can use it. And this is a good example here in Venice of us doing just that. So I'm proud to be able to be working with the folks here. We're going to continue to be here. We have more options now for folks in this county, and just in Venice, there's going to be a number of Publix locations that are going to be offering these starting on Friday. That's really good news for a lot of seniors here in Venice and in Sarasota County generally. So, Joe, do you want us to come up and say some stuff?
Yeah. Thanks so much, Governor. And I just want to say that leadership matters, especially in times of crisis. And what I do every day is field phone calls from my constituents across Sarasota, Charlotte, and even Manatee members, and everybody, literally people banging at the door saying, I want to get vaccinated, because everybody's scared and they have the right to be scared. This pandemic has caused a lot of people to have a lot of concern. But what this governor has done in terms of the rollout, his public-private partnerships, and really over the last week, what it shows you, what a local and state partnership can derive. This 85% increase to our local communities is a massive deal, because it's actually 85% plus when you think about all the public-private partnerships and those other doses coming. Commissioner Ziegler, I see Councilman Nick, I see Ron Kutzinger, another county commissioner, but Chris Ziegler called me and said, our South County, we're literally, everything's in North County. We need more help. What can we possibly do to get more vaccines here to the people? And I called the governor right up, and literally within 24 hours, here we are. And what's amazing about this whole thing is the fact that they got this entire site. So the emergency crews, all the first responders, and the state, the organization, get all this set up and get all these shots out. These 3,000 additional shots here in Venice. The additional doses that we're getting this week as a supplemental effort. I know we're going to Charlotte tomorrow. It all makes it's a huge deal to the constituents, and I just want to thank the governor for his leadership throughout this crisis. It's not easy, and when you think about everything else we're going through as a state with the economy and everything else, it's I'm so thankful to have a governor that values freedom and liberty and to allow us to be open. And so for that, Governor, just keep up the great work. Thank you so much for your efforts here in Southwest Florida, and we're ready to lead, but thank you.
Yeah, no, absolutely. Well, thanks, Senator. And it's interesting. If you look at December and January in the state of Florida, and you looked at the projected revenue that was due to the government and then what we actually took in, we took in about $550 million more over those 2 months than was projected. And you see a lot of these other states that are so intent on closing people down. We've lifted people up. We've trusted Floridians, and they've responded, and you see what's going on. People are trying to come here to do business and to entrepreneurs, jobs, you name it. And I think it's because, we really focused on the big picture. And as of right now, we're, I think of all the states, I think we're 29th for cumulative COVID per capita cases, 28 states higher than Florida. And in mortality, we're 26. So you have 25 states plus the District of Columbia that are higher than Florida in the per capita mortality. And so we've always focused on our vulnerable population, whether it was nursing homes at the front end or seniors first now with the vaccines. And I think that approach has proven to be more effective. I watch what's going on in our country, and it's like, oh, well, after 100 days, we will have maybe half the kids can go to school for one day. And I'm like, we've been open the whole time for schools. We've been open since August in person. Every parent has a right to send their kid in person. The vast majority exercised that right. And the ones that did virtual, many of them immediately tried to get their kids in person. We followed the evidence and the data. We didn't follow special interests. We didn't follow hysteria. We did what was right by students and families, and we're much better for that. And the fact that you're going to have schools that are going to be closed for this entire school year and probably even into the fall is a national disgrace. Florida led on education. We were there for our working parents. We were there for our students, and we're going to continue to do that, and we are not turning back. Yes, ma'am. So it's something that we're looking at. I don't have anything to announce now, but if I do, we will be sure to let you know. The media is worried about that, obviously. You guys really love that. You don't care as much if it's a, quote, peaceful protest, and then it's fine. You don't care as much if they're celebrating a Biden election. You only care about if it's people that you don't like. So I'm a Bucks fan. I'm damn proud of what they did on Sunday night. And so in terms of the UK variant, here's what we know. We know, based on all the evidence, that these vaccines are going to be effective against that. And that's really the main concern. I mean, we're getting our seniors vaccinated. We've not seen any data or any evidence to suggest that these vaccines are not effective. And so if we get the seniors vaccinated, we're going to be good, and that's what we're going to do. If there's data that comes out, not an academic model from Neil Ferguson, but actual data that comes out that we should let people know about, or that should change the approach of vaccine, or any of that. Obviously, you're going to follow that and see. But I can tell you most of what I've seen about it has been more based on modeling rather than based on actual evidence. And again, the vaccines, there's not been any problem demonstrated with the vaccines. And so that was my main concern with it. And I think we're going to be in good shape there. If something changes, we will let you know. Yes, ma'am. Well, I want everything done as quickly as possible. We obviously were able to expedite a lot of projects over COVID, and I think that saved probably months worth of traffic across the state. And we want to continue to do it, but the DOT knows that that's what we want to do, and we're going to find every way to do it quick. Yes, ma'am. Yes, sir. So the question is how do you ensure these are folks that are local? Well, two ways. One is these names were put together through the county. So they got county folks. They did it. It was ready to go. They had the names. People were signed up, and all you do is show up and do it. In the broader question, we've said we're not doing vaccine tourism here. I can tell you that behind the scenes, we've gotten pushback from CDC on that. They don't believe you should have to show ID or anything like that. I'm sorry, in Florida, we want to know that you're a Florida resident. You could be a half year because that's a lot of people come here for half year. We get it. They got doctors here. But we don't want people traveling from out of state or out of the country even to be able to do it. We want to focus on the folks that are our friends and neighbors. And I think that's approach. But we do. Are you 65 and up? And then are you here? Here, because it was done through the county, I don't think there's going to be a problem with it. With the public sites, I don't think that's going to be as much of a problem either. We obviously are doing the Florida residency for that. Initially, when we only had it in like 10 counties, we'd have people drive hundreds of miles just to go to a Publix. That was not really the intent. I mean, obviously, they're free to drive if they want. But because there's so many retail sites now across the state, then it's something where you pretty much have access. Most, I would say probably 80 to 90% of the counties have a retail site that's relatively close. Now, some places, Venice, it's going to be great because you're going to have 4 or 5 right here. Palm Beach County, there's 60-some Publixes in Palm Beach County that's doing it. 90% of all seniors live within 2 miles of at least one Publix. And so that's what you're looking to do. This way, you don't have to even think about driving across the state. But in terms of out of state, people that are just visiting, tourists, not doing it. I will say, though, the fact that someone would even think about coming here from Brazil or from South Africa or wherever to come to Florida, it kind of blows up any fake narratives that somehow seniors aren't getting shots here. Because if they weren't getting shots here, no one would want to come to get shots here. They see people doing it. Seniors here are getting shots. They're telling their friends in these other states, hey, I just got it. And they're saying, well, wait a minute, you're 69, I'm 69, I'm not even eligible in my state with that. We said 65 and plus since as soon as we did the healthcare workers and we had nursing home program, we said we've got to get into 65. And I think that was the right thing. Yes, ma'am. It was Publix. I misspoke. Yep. Sorry. Yeah. So it was the Publix, and which is good. And I actually think it's 15, but we can get those actual numbers for you. So it was Publix, and we may still do Walmart in those because I think what's going to happen with Walmart is they have a certain allocation that they're getting from the federal government, and I think they did it really smart. They're doing over 100 stores across the state. They're not going to be doing 100 shots at each store every day, which they probably could do. It's going to be less than that. But what will happen is as more allocations come in, they can do that. And then they'll also be able to replicate that model and get it into some of these other communities. So we want them. We did ask to look at Sarasota, Manatee for Walmart, and it may be something that they do. And then even if they don't do it with our allocation, that could be something that we look at as well. I mean, there's nothing preventing the state of Florida from asking Walmart, hey, can you do these 10 locations in Manatee and these 10 in Sarasota? We can provide the dosages for that. So we're looking at doing that as well. I'm going to figure out probably today or tomorrow what we're looking at in terms of next week's dosages. We anticipate it's probably going to be about 325,000 with the federal pharmacy program still turned on, which is great. But if we do get more, then we're going to go to this sheet that the Department of Health puts out that says percentage vaccinated. We've got some people have just done a fantastic job. I mean, you look at Leon, 61%. Alachua and St. John's, 56%. Some of the rural counties are very high because when you're dealing with smaller numbers of people, it is easier to do. But when we see Sarasota at 25%, We want to get that in the 40s as soon as we can. When you see Manatee at 23%, we want to get that. Charlotte, same thing. So I think you're going to have more opportunities to be able to do it. Yes, ma'am, one more. Well, stay tuned for tomorrow. We're going to have a great announcement for Charlotte County. It's very important, and obviously I'm citing those numbers. We want to do something about it. Charlotte was one of the first on the west coast of Florida to be able to get Publix, and I think that that's been helpful. But we're going to do more in Charlotte, absolutely. We'll have an announcement on that tomorrow, and I think people will be really happy. And so Charlotte, Manatee, and Sarasota, those three, we've sent more doses to this week. And those are priorities for us to be able to make sure that seniors, we're going to be able to run through thousands and thousands of seniors a day in all those counties, and that's what we're looking to do. So you can tell them we hear them, we're acting, and I think you're going to see a lot of them are going to get shots very, very soon. Thanks, everyone. Good to see you. Thanks, guys. Thank you.
Hey, Christian. Will you let me grab a picture with him real quick?
Yeah, we'll be right back. Hold on.
Christian.